I want to share something personal with you. A few years ago, someone close to me delayed getting medical care. Not because they didn't need it, and not because they didn't work hard, but because they were afraid of the cost. They had broken their collarbone, and they were afraid the cost of an ambulance ride would break them financially, even with their insurance. Or maybe you've heard of Jenny Ray Peters, a single parent with breast cancer. After multiple surgeries, radiation, and chemotherapy, even though she had insurance, she was still left with $30,000 in medical debt. If you live in California, that might sound familiar, or you know someone that's gone through something like that. Most of us do. Here's the truth. California has some of the best doctors, nurses, hospitals, and researchers in the world. But we also have one of the most expensive, confusing, and wasteful healthcare systems ever designed. We pay premiums, we pay co-pays, we pay deductibles, and we pay and we pay. And somehow we're still not sure we can afford to get sick. It's not a failure of medicine, it's a failure of structure. I've spent the last year reviewing economic studies and studying what drives healthcare costs. Not talking points, but real data. And everyone who knows agrees on this. Administrative waste, fragmented coverage, and opaque costs and greediness are costing us far more than the care itself. Our representatives aren't doing enough to help. They just keep putting a Band-Aid on the problem. It's time for Commonsense healthcare. That's why I developed the California Commonsense Healthcare Act. I call it CCH. This isn't about ideology. It's about common sense. Under this proposal, every Californian has access to comprehensive health care. No premiums, no co-pays, no financial punishment for getting care. You keep your freedom to choose your doctor, and costs are controlled through negotiated drug prices and efficiency, not rationing. Private insurance doesn't disappear. It operates in parallel, fairly, transparently, and without price gouging. This doesn't happen overnight. There's a 4-year phase-in designed alongside professionals and healthcare experts to avoid disruption and protect patients and providers. The system also introduces a secure digital health ID, something that experts have been calling for decades. So doctors have accurate records, emergencies are handled faster, and duplication is eliminated. Less paperwork, less waste, better outcomes. So why am I raising money? Because meaningful reform requires real infrastructure. These funds are going to go towards setting up a nonprofit, establishing a legally regulated PAC, state and federal filing fees. This is the first phase, the setup for the big show, if you will. From here, once we set up a nonprofit and PAC, we move on to canvassing and collecting signatures. But first things first, I'm setting it up to win, and that's how your donation will help. The legislature isn't going to save us. They've proven that. They've had years to do it, and it's still not done. Change happens when enough regular people say this matters. If you believe healthcare should be something we rely on, not fear, if you believe healthcare costs shouldn't cost you your dignity, if you believe California can lead with reason and common sense, I'm asking you to donate what you can, share this campaign, and be part of something that actually moves the needle. This isn't charity, it's civic investment.